Bismillahirrahmanirrahim. What is polio and how do you prevent it? Polio vaccination, polio symptoms and causes. What is polio? Poliomyelitis is disease caused by polio virus. It is one of leading cause of permanent paralysis in children, inability to move the parts of the body, and it can result in death. Two types of polio: non-paralytic polio, also known as abortive polio. It does not lead to paralysis. Paralytic polio, severe form of polio affect the spinal cord, brainstem, and can lead to paralysis. These are the two types of polio. Symptoms of non-paralytic polio: fever, vomiting, headache, sore throat, back pain or stiffness. These are the symptoms of non-paralytic polio. Paralytic polio symptoms: meningitis, flaccid paralysis, loss of reflexes, paresthesia, tingling, severe muscle aches, and paralysis. These are the symptoms of paralytic polio. This child having polio virus. World Polio Day is the 24 October is the World Polio Day. Structure of polio virus. This virus is showing risk factor for paralysis in polio. Risk factors are poor immunity, pregnancy, injury, intramuscular injections, and tonsillectomy, surgical removal of the tonsils. These are the risk factor. Pathogenesis: virus replicate in oropharyngeal and intestinal mucosa, then it is called elementary phase. Then virus spread to the tonsil and multiplies in pear patches, then it convert to the lymphatic phase. Virus then absorb in bloodstream and spread to the internal organs and lead to the viremic phase. Viremic phase leads to neurologic phase. Virus spread to the spinal cord and brain and then result in the paralysis of the limbs. Types: spinal polio. Spinal poliomyelitis is the most frequent and characterized by flaccid paralysis of the muscles innervated by motor neurons of the spinal cord. Bulbar poliomyelitis results from destruction of neurons of brainstem and can be fatal by causing respiratory and cardiac failure. Spinobulbar polio, combination of both. Wild polio virus weekly update 24 May 2023. इन 2022 में 30 चिल्ड्रन थे जिनको पोलियो हुआ था. टेक केयर ऑफ़ योर सेल्फ एंड योर चिल्ड्रन हेल्थ टू प्रिवेंट पोलियो. वॉश योर हैंड्स विथ वाटर एंड सोप. कीप योर टॉयलेट क्लीन. बॉयल वाटर फर्स्ट एंड देन ड्रिंक. कुक फूड एंड देन ईट. Global polio surveillance action plan, AFP surveillance, environmental surveillance, surveillance for primary immunodeficiency disease, global polio laboratory network, polio information system management and oversight. Complication of polio: myocarditis, hypertension, pulmonary edema, urinary tract infection, paralysis of leg or arm, constipation. There is no treatment for polio, it can be prevented only. Treatment: painkillers like ibuprofen, ventilator or device that helps to breathe, physical therapy that can help to keep your muscle working, bed rest and fluids for flu-like symptoms, antispasmodic medication, antibiotics and heating pad for muscle aches and spasm. Salk versus Sabin vaccines. These are the two vaccines for polio virus. Salk killed formulated vaccine. Virus given subcutaneous or intramuscular induces circulating antibodies but not local intestinal immunity. Prevent paralysis but does not prevent reinfection. Not useful in controlling epidemics. More difficult to manufacture and relatively costly. Does not require stringent conditions during storage and transportation. Has a longer shelf life. Sabin live attenuated virus given orally. Immunity is both humoral and intestinal, induces antibody quickly, prevents paralysis and prevents reinfection, can be effectively used in controlling epidemics, easy to manufacture, required to be stored and transported. Like, share.